I drew comparison between
teachers and doctors. The basic reason is teachers do conduct a test, examination, you heard, pathology test, urine test, blood examination, urine examination, and once they find a disease, they find your creatinine is not perfect, they analyze the test results, hemoglobin is beyond the permitted limit. What do the doctor do? They treat you, they take care of you, they prescribe, they don't scold you, they don't tell you that you are not good. You have fever, you are not good. You have stomach problem, therefore you are not good. They don't do that. What do? They look at you, take care of you, console you, tell you that you have this medicine for 3 days, you will be alright. We will see if it is not alright, we will do it again. Repeat it some more time. Eat only this, don't eat this. Sleep well, take care of your health. You will improve, you will be alright. They will never tell you that you are useless. You cannot do this. So what is the aim? From the red mark, which is poor, bad, not good, to the excellent quality, the green mark, you have to shift. That is the aim of a doctor, aim of a student. But what do we do as parents, as teachers? We scold, tell that you are not good, you are useless, you cannot do it. Compare with somebody else. Do your doctor say that, no? Compare with some other person, he didn't get fever, you only got fever? No. So what is to be done? Console, be with your children, understand what is the real problem they have, and then treat them well. We have good movies. Look at what is done. Tare Zameen Par. Best examples of being good teachers. Chalk and Duster, Hitchkey. All teachers and parents, watch this movie, understand. Don't tax them too much. The educational psychology says that a student has to learn less than an hour, in which in a classroom teachers repeat, and therefore the content delivery is only 20 minutes to 30 minutes. They adopt different styles of teaching. Apparentist type, deductive, inductive, discovery, all the styles are tried. Understand, the child also have got different style, and they accept little, understand little. If that doesn't work, what is to be done? Try a different style. For every student, the style can be different. Therefore, understanding the learning style of the student is most important as far as a teacher is concerned. In any diseases, treating a patient is very simple, except in the psychological diseases. A psychologist who understands the patient, maybe 1,000 patients, they treated and successfully done their job. Understand, the next patient is not to be treated in the same style as the earlier patients are treated, because every psychological patient is different. Understand, a student has got a problem. He is not a normal patient, he is a psychological patient. Therefore, a teacher has to be much better than a doctor, more considerative than a doctor in understanding the student and treating them well, as a psychologist does to his patients. So students who are not performing well are patients, but not a physical diseased patient, but a psychologically diseased patient. They have psychological, emotional, intellectual problems, which could be from physical, social and spiritual spectrum. So a teacher has to have knowledge about all the 5 aspects, like physical, emotional, intellectual, social and spiritual arena, and understand the student perfectly well so that the teachers can treat. So teachers are mentors, teachers are counseling experts more than a subject teacher as far as a poor student is concerned. As far as a student who are not able to perform well is concerned. Maybe for a bright student whose health is alright, who has got keen interest in learning the subject, the most intelligent teacher is one who knows that subject. The best teacher is the most intelligent teacher who knows the subject perfectly well. But for an average, below average student, it's more of mentoring, counseling, directing role the teachers are to play. God bless you. Make your teaching job perfect. Make your children happy in learning the subjects which they wanted to learn.